everyone, to another edition of Markets Hunters. I am your host, Hunter Gaylor, and I am joined today with the CEO of Better Health Sciences, Ilya Strashan, and we are going to be talking about his company. Just a few housekeeping rules before we get into the program. Make sure you like and subscribe to all of our channels. This will also be on LinkedIn, and subscribe to our newsletter because this goes out as well. And this is the Market Hunter Show. Welcome, everyone, back to the Markets Hunters podcast and show. As I said earlier, we were joined by Ilya Strashan. He is the CEO of Better Health Sciences Inc., a very innovative company, and we're looking forward to speaking with him. Ilya, thank you for joining the program.
Thank you, Hunter. Thank you for having me on.
Yeah, no, it's an absolute pleasure to have you on the program. So I just want to kind of start from the beginning with getting to know you a little bit, giving your background, talk a little bit about Better Health Sciences that's trading under the stock symbol TMSH. So yeah, if you just give us a little brief background about yourself and what got you into this position.
Yeah, absolutely. So I'm Ilya Strashan. I'm the CEO of Better Health Sciences, division of TransGlobal Assets Inc. My background originally was in technologies, marketing, and advertising. Beginning my career in the printing and technology space. I had a passion for art, which pushed me to combine advertising and marketing, and seeking a little bit different career choices than just the printing industry. It allowed me also to target companies that were lacking attraction but had potential to add shareholder value. In early 2015, I had the opportunity to dive into the cannabis sector, which was just starting to gain traction here in Canada. There, I was lucky. I got to start on the clinical side, working directly with physicians, with scientists, formulators, learning both from the physician side and the clinical side, and formulations, figuring out different products that were useful for patients. It was still a very early segment here and sector. Learning also, from the leading horticultural and agricultural industry experts, learned best practices, brought standardization to an industry that didn't really have those practices implemented in the legal market yet.
Sure. Well, I think that's a great point that you make, and I'd like to kind of go into it from an investor perspective, right? When we look at companies and we talk with CEOs, but if you could just touch on the current situation at the company and the direction that you really want to see it go.
Our main objective was really to put ourselves and give ourselves a big, I'd say, foothold on the clinical and medical side of cannabis.
Sure.
There's a big rec market here. There's a rec market in the States. It hasn't flourished the way that investors, I think, intended it to be. And I think there's a lot of things missing that people aren't really taking a closer look at on the medical side. So
Okay.
this is a medicine. This is something that helps patients. This is an alternative to other treatments, and also can be combined with treatments that people are already using in traditional medicine. At Better Health Sciences, we started on the clinical side. We've grown that. That's kind of our strong position there. We've done some fantastic acquisitions, increasing our patient database by bringing in Synergy Health, which gives us access to not only the cannabis side, but more of the traditional and alternative treatments as well. So that gives us a foray into not just cannabis, but all health and wellness sciences.
So with that being said, Ilya, if you could just maybe talk a little bit about some of the subsidiaries that you're working with, some of the JVs. I know that there's some things you're working with CannaScribe, and then you have a joint venture coming out with CannaKing as well. Can you talk a little bit about that process, and then also where you see the growth of those subsidiaries over, say, the next 3 to 5 years, and what the growth of those brands or companies would be?
Yeah, absolutely. So CannaScribe, again, because we've got years of patient data, It's given us a great insight into what works, what doesn't. Synergy Health, which we acquired, um, again, expands on that footprint, giving us actually a lot more referring doctors and sources for our patient database.
Mm-hmm.
And then the recent JV with Cannaking, Cannaking's a great company. They've got a slew of products that have been in the hopper and ready to go into market. Uh, Products that haven't really been utilized in the industry. And using our patient data, we're able to cherry pick the best products out of their product lineup, improve on some of them, and bring them to market. This we're really excited about because there's a lot of really good things coming from them, product wise, and the combination of our background on the clinical side, we have the patients that we can directly expose those products to, which is great. Not a lot of companies can say that they can create a product and get them right into the hands of patients.
Well,
Which
that's very important too. So it seems to me that that growth with those particular companies are really going to exceed. So we're kind of coming to the end of this year, and there's been a lot of developments with the company, obviously, which have been positive. So as we kind of come to the end, you had mentioned a couple of things with the challenges of obviously the cannabis space, but because you started on the clinical side, can you give us a little bit of what your outlook is for, say, the first and second quarter of next year? What are some of the barriers that you're going to have to overcome? Obviously, I know there's some, because they're medicinal products, obviously being approved by the OHIP and insurance, but I'd like for you to expand on that a little bit.
Yeah, I mean, there will be some challenges in terms of just market growth because of the regulations.
Mm-hmm.
We've already found and identified ways to exceed that.
So, given your outlook on Q2, what are some of the major barriers that need to be overcome? Obviously, you were mentioning some of the medicinal products being approved, government regulation. Can you go into that a little bit?
Yeah. So some of the government policies that are still being put into place, we're working to find solutions to those. We've teamed up with key organizations to spearhead us and champion us through the government process. That will be some of the things that we're targeting in the first 2 quarters of the year. Again, working with different insurers to create plans that cover patients properly and allow insurers to cover these products for them. We're going to be heavily concentrating also on R&D and formulations.
Obviously, that'll help streamline a lot of the development and go to market, I would assume, correct?
Absolutely, and also identifying and teaming up with key distributor partners that can spread our market reach not only in Canada but nationwide and internationally.
Oh, that's very good. So, when you're in this position as CEO, obviously it's a public company. A lot of the big questions we talk about is creating shareholder value. What are some of the ways, obviously, that you're going to be doing that as you're continuing to expand these partnerships and overcoming the government regulations and bringing in the necessary people? What are some of the things that's on your priority list for increasing shareholder value, and obviously with the goal of increasing the revenues and growth of the company?
Yes, absolutely. So we're going to be heavily utilizing our current networks to drive sales of medical products and develop new product offerings there. Further acquisitions of strategic companies. We already have identified various key targets that will strengthen our offerings, help to develop new and leading products, and expand our footprint. Like I said, both here in Canada and internationally. We are strengthening our board and industry experts that we're bringing in-house. We really feel that that's a key objective. We need to have the best people on our team, and these key individuals will help to spearhead and drive the company into the right directions. Distribution will be huge, figuring out ways and increasing our foothold in the markets. So there's quite a lot lined up for this year. Big objectives that I'm sure we're going to hit.
Yeah, no, that's really exciting, and obviously, a lot of the audience here, when we talk with CEOs, we're always looking at that forecast from an investment perspective of what the next 3 to 5 years looks like for that investor, right? And so in this industry, which is obviously a massively growing industry, we're seeing a lot of organizations start moving to the medicinal, homeopathic, medicinal, cannabis-driven, natural derived products. Where do you see your industry? Or this industry, if you will, in the next 3 to 5 years. And with that, have you identified what some of the bigger opportunities are outside of just grabbing more market share? I mean, is there new product development? Is there new R&D? Maybe walk us through where you, as kind of the CEO, see the industry going in the next 3 to 5 years.
I think that there's still a huge investor stigma in the cannabis industry. The past couple of years have been a roller coaster ride for investors. We're going to be bringing a focus to education and targeting the growth of the medical and pharmaceutical cannabis industry. Our target market is not just recreational. We have a good footprint and a highly regulated and standardized market that we work with a consistent patient database. And they use these products on a daily basis, right? So this is medication that we're going that they're going to be using. It's not just a one-off. They're going to be using it not just for to heal what they have, but also for preventative medication going forward. Mm-hmm. Overall, we see this growing into not just a cannabis portion, but overall wellness and health. We have a direction into longevity as well. That's kind of a key sector that we're going to be adding into our wheelhouse. That will give us opportunity to expand beyond what we're concentrating on now and go into really what we see the future is wellness, health, longevity.
Wellness, health, and longevity. I like that. Wellness, health, and longevity. That's good.
Correct. Yeah, it's people want to stay young. We want to stay active. The traditional medicine sometimes doesn't even focus on that. It's just about once you get sick, how do we try to get back? We need to create preventative medications and treatments, and have a real focus on long, healthy life.
Well, and we are seeing, right? I think education is a big point here, and I just want to bring this up because this is a good note that you brought up. I think for the viewers and listeners, is that the education is critical because a lot of people don't even read the labels on the back of their vitamins that they buy. All right, and seeing some of the chemicals that are in the vitamins, and they're not healthy at all. And so a lot of these medicinal, a lot of these all natural products and things that are coming out, and the delivery method, I would assume is going to be part of that, right? Whether it's chewables or any of these other type of offerings. So it's going to be very interesting to see this space continue. Let me just ask some kind of closing questions here for you. Obviously, there's been growth in the sector, okay? And being that you're in Canada, talk a little bit about the difference between the U.S. marketplace and the Canadian marketplace with regards to this particular industry sector.
So two things. On the cannabis side, we're federally legal here, which makes the landscape completely different to the States. Okay. Medical is also a key component of the market here, whereas in the States, it's very much concentrated on recreational and just state by state legislation. So hopefully we'll see that amalgamate and become a federal law in the States, so we can work better there and create change across the whole country. In Canada, there's still, I think we're a little bit behind on acceptance of the cannabis space as a preferred medical treatment. There's also one of the challenges I think going forward is that on the traditional and alternative practices for longevity and wellness, where we want to be targeting, there has to be more acceptance of that here as well, legally and from a consumer point of view or a patient point of view.
Sure.
For instance, I think in the States there's clinics that specialize in this. Here, it's not that accepted.
Got it. So, Ilya, I think kind of the following, the final kind of closing question for you is obviously this is better health sciences, right? And we really kind of focus on that wellness, better, happy, consumer and educated consumer. Is there any real thing that you're passionate about within this sector that you feel that the shareholders should know that is vital to the health and success and growth of your company?
Absolutely. We're going to be creating a strong alignment between the traditional practices, alternative practices, naturopathic practices. We need to have we need to give not only our patients but also our shareholders access to a whole range of treatments. And we're really excited about that because we're expanding those offerings and we're bringing them from around the world to here, both Canada and America, and creating not only a virtual space but clinical spaces where patients can come, could get these treatments, and become healthier.
Well, I definitely healthy is the place to be, right? That's what we look for in society. We want a healthier society. We want a more educated society, so that we know what it is that we're putting in our bodies, and we're looking forward to following better health sciences. And it's these conversations with CEOs like you that help in the educational process, getting it out there for not just the investors but the consumers as well. So we look forward to following the journey of your company. Ilya, thank you so much for coming onto the program today. It's been a pleasure to speak with you.
Likewise, Hunter. Thank you very much for having me.
Thank you, and hopefully we'll keep the conversations going, and we'll bring more updates as the company continues to expand. And we'll see you next time on the program.
Looking forward to it. Thank you, Hunter.
Thank you so much. So I was just joined by Ilya, who's the CEO of Better Health Sciences. Their stock symbol is TMSH. Really incredible. Obviously, their company is growing through their subsidiaries and a lot of their medicinal products that they're working on. So we're going to be following the company very closely to see just all the advancements that they're doing. So we're looking very much forward to bringing more information on the company. Also, for more access to interviews like these, make sure you go to our X, Twitter site, along with LinkedIn. We're across YouTube. We stream across all channels, bringing you a lot of opportunities to consider just like this. So we look forward to it. Make sure you take a look at the link below. It will give you all the information you need on the company with links to their site as well. So we look forward to more conversations just like this. And as always, have a great day.
Coming to you live with the insight you need from the financials and political capitals of the world to the heart of innovation. This is Opportunities to Consider with your host, author, speaker, and corporate strategist, Hunter Gaylor.